The first step in devising a study plan is to determine roughly how much effort will be needed. If you've recently taken the certification exam and failed, your score on that examination should be a good estimate of where you are, unless there was some other mitigating factor, such as becoming ill during the test, abandoning the test, or some similar event. If you've not recently taken the certification examination, you can download the in-training examination, starting with the 2008 version. Take the test, score it, and then use that score as the estimate. Remember, all diplomates and all residents from ACGME accredited family medicine residency programs have access to recently administered in-training exams. You need only log on to our website and download the test, the images, and the critique. Here are some general guidelines for how much study is required. More than 60 points below the passing standard, 1 hour a day, 3 times a week for 3 months. Between 10 and 50 points below the passing standard, 1 hour a day, 2 times a week for 2 months. And at or above the passing standard, 1 hour a day, 2 times a week for 1 month. I would point out that although 3 hours per week times 4 weeks per month times 3 months equals 36 hours, this is not the same as studying 6 hours a day for 6 days. The value of the first hour of study is not equal to the value of the 5th or 6th consecutive hour. And studying in that way eliminates the time for reflection between study sessions. Cramming is inefficient and doesn't work well. Even if your estimated ability on the in-training exam is at or above the passing standard, I still recommend studying. If this ability estimate had come from the certification exam, then you wouldn't need to test for several years, so there would be no need to worry. However, because it came from the in-training examination, the ability estimate is only an estimate of how you will perform on the certification exam. If you score at the passing standard on the in-training exam, then you will have about a 50-50 chance of passing the certification exam. You will likely want your odds of passing to be higher than that. In all cases, I also recommend that examinees commit to a minimum of 2 days a week for study. This is because most people can rarely successfully commit to doing anything only once a week. Now, these are guidelines for study time and do not include any of the time required to acquire and organize the study materials. Please keep in mind that this is only an estimate and does not guarantee that you will pass if you do this. This also assumes that the study, 1, is uninterrupted, 2, has your full concentration, 3, is well targeted to appropriate topics, and 4, is immediately followed up with thoughtful reflection on how the material can be applied.